أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله تعالى وبركاته رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. And welcome to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. I'm your host this evening, Najwa Mohammed Luddy, coming to you live from the studios of Cape Town, mashallah. Tonight's topic, we'll be discussing first aid in the home. Very, very interesting, very important topic of discussion this evening. And our lines will be open to all our viewers on 021 696 0109. And of course, the telephone number will be running on your television screen very, very soon, inshallah. But before we start our program this evening, let's listen to the tarbiyah of tonight's program, inshallah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Quran is a miracle that Allah revealed to His Prophet Nabi Muhammad sallallahu alayhi wasallam, and it is a blessing for humanity. The Quran is not only a guidance for mankind, but Allah has made it a spiritual cure and healing for all types of ailments. This includes treatment for all worldly problems, physical, psychological ailments, and spiritual. Creator has clearly told us that the word of the Quran are a shifa, which means healing for all, and therefore, when used with the real belief in one's heart, this form of treatment can bring miraculous cure to all forms of ailments. Allah says in the Holy Quran, "And we send down of the Quran that which is a healing and a mercy to those who believe." Quran, Surah 17, Al-Isra, Ayah 82. As for other forms of treatments, Islam does not discourage the use of treatments available to us through medical and other sciences. On the contrary, the use of such treatments is encouraged by the teachings of the Prophet Nabi Muhammad sallallahu alayhi wasallam, who sought the treatment of illnesses and diseases for himself and urged his followers to do the same. Thus, seeking medical treatment for the cure of diseases is part of the Prophet's tradition. We find in Sahih al-Bukhari, book 76, that the Prophet Nabi Muhammad sallallahu alayhi wasallam said the following: "There is no disease that Allah has created except that He also created its treatment. So for every disease there is a medicine, and if that medicine is applied to the disease, he will recover by Allah's will." This sentence clearly describes that Islamic teachings fully support the use of all forms of treatments, because the underlying principle is that Almighty Allah has created cures for all diseases. The key is to ensure that the right type of treatment is applied for the right type of ailment. The only condition in Islam is that all forms of treatment are allowed as long as they are not haram, which is against the Islamic teachings. Sadaqallahul Azim. And I'm sure our viewers really, really appreciate that beautiful tarbiyah. And of course, tonight's program, as I made mention, we're discussing first aid in the home, and with me is my IMA member. He's also the president of the Islamic Medical Association of South Africa, Dr. Riaz Ismail. Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor.
Wa alaikum assalam.
Welcome back once again.
Thank you.
With our first interview with Doctor was just when we crossed over to Cape Town. Alhamdulillah. I mean, I think it's our 4th week running. Alhamdulillah.
Alhamdulillah.
Shukran so much, Doctor, for being here. Doctor, before we start our program, I just want to inform all our viewers that weekly the Islamic Medical Association will be running certain projects, and tonight I want to inform all the viewers that the Islamic Medical Association of the Western Cape will be hosting an ethics seminar that will be coming this coming Wednesday, which is the 14th of October, at the Academia Auditorium, Islamia College, that's in Lansdowne in Cape Town. And whoever wants to be part of this, please, you are most welcome to contact Sister Tawhida, that's our office manager in Cape Town, on 021 762 1414, That is 021-762-1414, or you may also email her on imasa.wk@gmail.com. And the talks will basically include ethical dilemmas in a GP practice, sexual diversity in Islam, parental consent versus the role of the healthcare professional, Islamic ethics of treating patients of the opposite gender, as well as the A4R approach to improve fairness in assessing dialysis in the Western Cape. And of course, the healthcare professionals are invited to attend the CPD accredited seminar by contacting Sister Doghida on the telephone numbers 021-762-1414. We also want to just remind all our viewers regarding the Convention 2016 that will be taking place from the 30th of April until the 1st of May, that is 2016, Lagoon Beach, Cape Town, that's in Milnerton. Of course, all the professionals are most welcome to attend, but you can also bring your families along for that 2-day seminar. And then another reminder, the Renal Dialysis Project has been running since 2007 in Durban, and we want to encourage the viewers to adopt a patient or donate some cash to the Islamic Medical Association's offices, and the telephone numbers are appearing on your screen. So shukran so much, Doctor, all the formalities, out of the way, alhamdulillah. So now I want to encourage all our viewers, please contact us with any questions regarding our topic tonight, 021-696-0109. We're discussing first aid in the home, and I've got the professional here with me. Doctor, maybe I must just start off by asking you, there's lots of things normally lying around our house which possibly could cause either minor or very, very serious injuries, on ourselves, on our children, or even people coming to visit. Maybe Doctor could just briefly explain to us, how do you stop, spurting of blood when something unforeseen happened, maybe a deep cut and something like that? Just the start of our program.
Okay, Najwa, just to start with, usually if you have spurting of blood, right, that's usually indicative of an arterial bleeder. So just for the viewers, there are two types of bleeders. Firstly, one will be venous, which
right,
is usually slow flowing and darker blood, and that's usually more superficial cut. Or you could have a red, bright red blood spurting out, and it's almost got a cycle to it, so it will do that, and that's as the heart beats, because that's arterial bleeder.
All right.
Those are the ones that you want to stop as soon as possible, and the easiest way to do that is to apply direct compression onto the place that it's bleeding. Elevate the limb, if it's a limb, elevate the limb above the heart. That reduces the amount of pressure going upwards, and once again direct pressure. And if you don't want to put direct pressure directly over the wound, pressure just before the wound. Okay. So proximal or closer to the body. Right. So if I can just demonstrate, if it was somewhere in your arm, around about there, what you would do is you'd apply pressure somewhere here.
Okay.
So that will then hopefully stop the bleeding, because you'll compress the artery above that, and you'd be able to get control of the bleeding. But usually direct pressure over the wound and quite a sustained pressure should stop it. But if we can just go back to what caused the injury to start with,
right.
What we want to try and do with this program this evening is firstly try and prevent injuries.
Of course.
And you need to, like you child-proof your house, you need to safety first your house. So you need to ensure that there are no sharp objects lying around, that there are no chemicals in the reach of children. We'll discuss that a bit later on. You want to ensure that when you are working, that if you're up a ladder, that you have your lead, if you're working with power tools, out of the way, so that when you're coming down, you don't actually trip over the lead on your way down or on the way up. That if you are using screws, that they are kept in a box and not lying loose, so that you don't stand on them. So it's just simple things to prevent it to start with.
I think that's very important, Doctor, and often we don't think of those things. But I mean, you people in the emergency, people attending to patients all the time, a it does happen, you know, and sometimes it's very freak accidents, you know, and it does happen. So I think it's very, very important for our viewers, you know, to be part of our program also tonight. It is school holidays also for some of our children. So often our kids might even be alone at home as well, you know, without some supervision, maybe older children. So tonight, inshallah, that is what we want to encourage our viewers. You know, be part of our program by calling the numbers on your screen, 02169600109, anything relating to first aid in the home, because these things does happen. And doctor will also be giving us some great tips, you know, how to really safeguard, you know, and make the, not just child friendly, but safe friendly as well, our homes, because I think it's very, very important. Doctor, you did mention about something about the arterial bleeder and the venous bleeder. Does that mean there's a difference really between the veins and the arteries?
Yes, there is. The veins are more superficial. Those are the ones where we'd normally, if we're taking blood from you, those are the ones that if you put your hand over your arm and you just compress, you'll see them stand up almost immediately. And those are the ones that you can take blood from. Okay. Then the arterial bleeders are normally, arteries are normally deeper. You can feel them quite easily if you feel in your neck, that would be your carotid artery, or you'd feel at the wrist, that would be your radial artery. So those are the ones that are usually a bit deeper. And they carry different oxygenated versus deoxygenated, but also the pressure differences are important. Arteries are at a higher pressure, therefore they squirt blood out far quicker, and you can bleed out your blood volume very quickly, depending on the size of the artery and the incision into the artery.
Where the vein is basically oozing the blood.
It oozes out a lot slower.
Interesting, you know. Very interesting topic to all our viewers. Please be part of our program. After our break, inshallah, I'll be asking doctor regarding freak accidents. You know, what happens if we lose a limb? What happens if we lose, if you hurt yourself and you cut you use a hammer? All those freak things might happen to you. But inshallah, stay with us. We'll be discussing that right after our break. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. My name is Najwa Mohammed Luddy, and my guests with me live in studio, Dr. Riaz Ismail. We're discussing first aid in the home, and we want our callers to call us on 02169600109. Anything relating to any first aid questions that you might want to ask Dr. Riaz Ismail. Doctor, before our break, you know, you mentioned about the different types of blood, the oozing and the spurting of blood. But I think what's very important, maybe we should tell our viewers regarding a first aid kit. You know, what is the essentials that we need to have in our homes or even in our cars?
Okay, so firstly, there are many first aid kits available that you can pick up from either motor spare shops or pharmacies or various places. And the one thing that I'd like to pick up as we go along is the components of a first aid kit. And we should see a slide of that in a minute. But what we're looking at is bandages of assorted sizes. We're looking at safety pins, gauze and adhesives, the disinfectants, burn shield, sharp scissors with rounded tips, of which I'll show you an example in a few minutes, tweezers, eye patch, antibiotic cream, and your gloves. And then just the first one that we dealt with, which was the arterial bleeder, we'll see that out of that we used a bandage, and we used some gauze, and we used the tourniquet. And the tourniquet is not listed there, but the tourniquet is very easily made with a piece of wood and one of the bandages. So that could easily stop the bleeding as well. So if the listeners, at the viewers, at the end of the program, we'll put that slide up again so that you can see the components of what the first aid kit was, and we will then look at the different parts of the first aid kit that you've used, because many people have got a first aid kit but don't actually know which part to use for what. So for the first one, as we've seen there, as we see, if we've got an arterial bleeder, then we will use the bandage, direct pressure over it, or the gauze, direct pressure over it, but we can also use a tourniquet, and a tourniquet is very easily made with just a bandage and a piece of wood.
Doctor, will you be demonstrating as well in studio?
I will, not many of them, but I will.
Okay.
There's a few that I will do.
Okay, fine. Shukran so much. The number on your screen, 0216960109. Dr. Riaz Ismail live in studio. We're discussing very important first aid in your home, anything relating to our topic of discussion, inshallah. And maybe Doctor will even demonstrate, hopefully not on myself, inshallah. But Doctor, that first pic that we saw now, you know, there was spurting of blood.
Yes.
So in that case, you said we must try and just apply pressure.
Direct pressure over the area. So
Right.
what you want to do is you want to prevent the blood from coming out.
Yes.
But also, if it's really, if you're not able to get a tourniquet higher,
Right.
above it,
Yes.
then what you need to do is, or closer to the body. So if it's lower part of the foot, round about the knee or the thigh, if it's lower part of the arm, then you want to try and get higher up on the arm. But if you're not able to, like for example, the cut is in the groin,
Right.
then direct pressure over it.
Okay.
So direct pressure over the bleeding, and you want to apply as much pressure as possible to prevent the blood from coming out of the artery.
Doctor, also with doctors, it's your job to handle these type of
Yes.
things. With us, you know, being at home, maybe a mother or an office worker, when that happens, we go in a total panic mode. Is that a good or bad thing?
Adrenaline's a good thing, but
Okay.
adrenaline for the patient when the patient needs it,
Not
not for
good.
yourself. So
Okay.
what I'd recommend then is, firstly, take your own pulse.
Okay.
So you just for 2 seconds, just feel your own pulse. When you feel that you're still alive and that you have your own pulse, then you realize you can assist someone
All
else.
right.
Then
Okay.
get to trying to assist the person.
Right, right.
And if it's your child or someone else in your home, you obviously want to do as much as you can, but sometimes just taking a second or two longer to get there or to do what you need to do, you'll be of more benefit and more effective than if you were to rush in and you start panicking and
Okay.
screaming.
Yes.
You know, loud noise is a good thing at appropriate times,
Right.
but not all the time.
Okay, thank you very much, Doctor. Doctor, I'm thinking of a freak accident maybe happening. Maybe there's some renovations happening at your house and something unforeseen happened. You know, you cut off a finger, you know, or a digit, and obviously there's blood everywhere. What happened in a case like that? What do you do?
Okay, back to what we did with the first one, which is first principles, which is try to stop the bleeding. So out of your first aid kit, what you do is some gauze, and you put that over the stump where the digit has been removed. The next part is quite important. Pick up the digit, put that into a clean plastic packet. Okay, so not, and then that packet gets put into another packet with ice. But you don't want the actual digit into contact with the ice directly, or the water that the ice will then melt and cause. And in many instances, we are able to reattach digits, reattach arms, hands. So it's important that you actually, the severed part of the body,
Yes.
as gruesome as it might be,
Yeah.
put that into a clean packet, put that into a packet with ice, and take that along with the patient to the hospital, wherever you take the patient. But don't be so focused on finding the digit that you forget to stop the bleeding.
Right.
So if the person is able to, with their other hand, to keep a firm compress on the stump where the blood is squirting from, and often it's easy just to compress on the side of the fingers, because that's
Okay.
where the arteries run. So
Okay.
just compress on the side, and that should stop the bleeding.
Correct, correct. So I think very importantly what came out now, what you were saying, often our first will be to pick up maybe the finger or the half of the finger and put that directly into ice.
Yes.
And that is not a good idea.
That's not a good idea,
Right.
because the water will then cause the tissues to be damaged, and you don't want to do that.
And you might not be able to save that finger
Exactly.
at the end of the day.
Yes.
Excellent. Our viewers, please be part of our program 0216960109. We're discussing first aid in the home with Dr. Riaz Ismail. Doctor, obviously, you know, accidents happen in our home. What if you hit yourself, you know, on your hand or on your thumb or on your fingers very hard with a hammer, or somebody else does that on your hand? What happens in a case like that?
Spousal abuse is not advocated, Najwa. But if you were to hit yourself with a hammer, usually what you'd have is a compression injury of the area that you've hit. And if you're not very skilled at using a hammer, it's usually the fingers that get that obviously suffer the brunt of the injury to start with. That's a compression injury. We apply ice to that so that we can try and ease the pain and inflammation that you've got going. And then if it is deformed or you're unable to move the finger or unable to move the part that you've struck with the hammer, you need to seek medical advice, because you might then have a fracture or a damage of a ligament damage in that area.
And doctor, with the severed digit, you know, losing maybe a finger or half a finger, very importantly, should we rush that patient to the emergency as soon as possible as well?
Yes, we should, because the sooner you can attach the finger or the sooner you can attach the digit, the better. You have a certain amount of viability of the severed part, where your arteries and your veins and nerves in the severed part will obviously start dying back or cease to be viable. So you don't want to then have to trim too much of it off. So you want to try and get it there, and that's the reason for putting it on ice.
On ice,
to try and stop the cellular function, and then to maintain the viability of the tissues.
Yes. Thank you very much, Dr. Riaz. Dr. Cumming, if I think of burns, you know, often you hear of kids, you know, this morning in the newspaper there was so many things about people. Oh, sorry, I'll have to stop my question because there's a caller on the line. Let us go to the lines. Assalamu alaikum and good evening.
Wa alaikum salam.
Wa alaikum salam, dear. Please go ahead with your question to the doctor.
I have a question for the doctor.
Assalamu alaikum, carry on.
Assalamu alaikum, doctor. My name is Muhammad Zain Waja. I've got a question for you. If you apply CPR, is there different compressions that you use for adults and in children?
Yes, there is different compressions. We will cover that in another program with a bit more detail. But because in the adults, your compression rate has to be slightly slower than children. With children, you go slightly harder and slightly faster, and you maintain that as opposed to adults, which is slightly slower. So there is a different compression rate. But we will be covering that in the series in the next week or two. We will be covering that specifically.
Okay, shukran so much.
Afwan, shukran so much, my dear, and all the best.
Salam.
Jazakallah so much. Wa alaikum salam wa rahmatullahi wa barakatuh. Of course, the lines open on 0216960109. To all our viewers, you are most welcome to call us anything relating to first aid in the home that you would like to ask Dr. Riaz Ismail. He's live in studio. Doctor, before we took the caller, I asked about burns. Often you hear, you know, things happening, especially to people in informal settlements. You know, these things happen. What happens if you see somebody burn themselves, either with fire or with oil? You know, what do you do to that body? What happens?
Okay, so firstly what you need to do is, and this is the first principle in rendering first aid from ambulance personnel, from doctors or anybody on the scene of an accident, first ensure that the scene is safe. So if there is fire, you need to put the fire out. And the best way to do that is to roll, if the person's on fire, to roll them in sand to decrease the oxygen so that the fire actually goes out. Obviously if you've got a fire extinguisher or water at hand, that is be the next best thing, or that would be the best alternative to rolling them in the sand.
Shukran, doctor. There's a caller holding. Sorry, Ma, for that, but let us go to the lines quickly. Assalamu alaikum and good evening.
Assalamu alaikum, Najwa.
Wa alaikum salam, my dear. How are you?
Alhamdulillah, and salam to the doctor in the
Wa alaikum
studio.
salam.
Got a caller? You've got a question for the doctor, my dear?
Yes, I need to know, you know, sometimes in the house, kids bump their heads like crazy and then it swells up. What's your best remedy for that, doc?
The best remedy for that usually is ice, because the ice and not ice directly onto the skin, but ice into a face cloth which you've wet a little bit, so that the cold comes through the water onto the actual bump, and then you put that onto the child. But importantly, once again, children will scream and they'll be really upset by what has happened to them. And also if you then approach them with a big fat towel with ice in it, they get even more panicky. So explain to them what's going on. Try and calm them down first and then apply the ice. it's important to get the ice on, because the head and the scalp is very vascular, and you might get a little bleed, which then swells out quite quickly. But the ice will help ease that and reduce the swelling quite a bit. But importantly, don't let the child panic, because then you're not going to get very effective with whatever you're trying to do.
Okay. Shukran, my dear. Shukran, Karima. You go well. Walaikum salam wa rahmatullahi wa barakatuh. Alhamdulillah, good advice. You know, especially to parents, as I mentioned earlier, at school holidays, at school breaks. And these are important tips for us to know. Doctor, you won't believe it, we need to go for another quick ad break, inshallah. But I want to encourage our viewers, please call us 021-696-0109. We've got a whole lot of interesting things still that we're going to discuss. We're talking blisters, we're talking fractures, we're talking punctured wounds with knife stabbing, all those things that a doctor will be discussing with us right after this break, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. With me is Dr. Riaz Ismail, and we're discussing first aid in the home. The lines are still open, 021-696-0109. Anything relating to our topic, please call us. If you'd like to ask the Honourable Doctor anything relating to first aid in the home, because often these things can just happen, you know, especially if there's children around, or even sometimes other people's kids coming over for parties or sleepovers. We have to safeguard our homes, make it child friendly. Before our break, Doctor mentioned about, you know, what we need to do if we lose a finger, or we cut our hands, or we, you know, the hammer hit on our hands. What is the correct way, how to handle these things? Most importantly, we need to try and stop the blood. That's what doctor's basically trying to tell us. Doctor, talking about burns, I mentioned, you know, often you hear about informal settlements or freak things happen in your kitchen. What happened to burn patients?
Okay, so as we said, we need to first secure the area, make it safe, put the fire out, remove the source of burn. So that could be either hot liquid, water, tea, fire, or it could be fat. It could be any of those things. So what we'd want to do is remove the source. You want to remove the clothes, because the clothes can often continue to burn and smolder depending on the type of clothes. So if it's nylon, it can burn quite quickly. If it's cotton, it might prevent the burns from progressing any further. But you want to get the clothes off quite quickly. And for that, we will, when the slide is done just now, we'll show you the scissor that you can use to do that out of your first aid kit. You want to cool the area down or cool the whole body down, depending on what percentage of the body is burnt. And for that, you want to use clean, cold water. Now, we must remember that the actual temperature applied to the skin or to the part of the body that's exposed to it, that temperature will continue. The source might continue to burn and deeper into the actual tissue. So that's why you want to cool the area down sufficiently to stop that heat from further burning the skin, the tissue, the muscle down into a lower level. So you then increase the depth of the burn in essence. But if you do that by reducing with the cold water, you can reduce the depth of the burn. The one thing that we'll use out of our first aid kit, or the two things we'll use, is we'll use a scissor. And the scissor is a rounded edge. It's sharp, so it goes under the clothing, and you can then cut the clothing off. So this will be in your first aid kit, which is something you should have in there as well. And then the second thing, which is, if you noticed on the first slide, is we didn't have burn shield. But that's just to catch the viewers out, to make sure that they're paying attention. So they need to note down burn shield. They need to note burn shield, and burn shield comes in various packages, sizes, and comes in various containers. And application of that on after you've stopped the burn, after you've removed the cause of the burn, and liberal application of that cools the area down, and then and also helps to prevent scarring at a later stage. Depends, of course, on what caused it and the depth, but the burn shield works very effectively.
Fantastic.
And it's a definite need to have that in your first aid kit.
In your first aid kit. Doctor, you mentioned remove the clothing.
Yes.
What if the clothing has has basically burned onto the skin or into the skin. How do you handle that?
If that has happened, then rather leave that to the
Okay.
emergency unit to do, because that could be very painful.
Right.
So you just ensure that the clothing is no longer burning or doesn't have any heat attached to it.
Yes.
So soak it in water.
Yes.
And if it is attached and the skin is going to come off, if you were to remove it, don't remove it.
Yes.
Let it be done at the emergency
At the
unit,
emergency.
because you might need significant analgesia for removal of that clothing from the skin
Correct.
itself.
And you said apply cold water, not ice water.
No, well, cold water,
Cold.
Preferably just cold,
Cold
not
water,
necessarily ice.
not necessarily ice water. Thank you
Yeah.
so much. Well, viewers, the numbers on your screen, 0216960109. We're discussing first aid in your home, and you're most welcome to call us here. Anything relating that you'd like to ask Dr. Riaz Ismail, because these are things happening on a daily basis, you know, in our homes, at offices, sometimes even often in the car.
Yes.
You know, these things can happen. And I'm particularly thinking now, often we leave our children, you know, those ones that does not need to sit in the car seat, you know, but bigger children in the back seat, maybe eating some sweets. What if a child chokes, you know, with some food particles in the mouth, and you busy driving? What do you do as a parent?
First, the important thing is to first identify what's happening, because many times kids will scream or start gasping, and you're not sure if it's angry birds or if there's actually something going on.
Right,
But
yes.
if they have been eating and you recognize the fact that they are choking,
Yes.
and this would obviously go for anyone in
For
that
anybody.
situation who's choking,
Correct.
is to firstly, you need to stand behind them. So if you're in the car, as the situation you've sketched, is to ensure that you pull the car off safely.
Correct.
Put your hazards on. Get out, go onto the side of the road where there is no traffic. I can't stress this more importantly enough, because many times people have stopped to change a puncture or to get out of the car to assist somebody and have been knocked down.
Correct.
So get out of the car safely, get to the other side, get to the child. Okay, and what you want to do then is you want to turn the child with their back facing to you. You want to take your hands, as the slide will show in a minute, and you want to cup your hands together. You want to then place it into the underneath in the epigastrium. Okay, and then you want to, in the area just below the breastbone, okay, which is best said on the slide, and then you want to thrust up and in with sufficient force to lift the victim off his feet. And what you're basically doing is you're creating pressure onto the diaphragm, and that then causes the person to cough up, and that pressure forces back up. That's why it has to be a short, sharp movement inwards and upwards, so that you can lift them up, and that creates that pressure so that they can actually cough up the particles that they've been that they've ingested.
Right.
Sometimes just a nice firm smack on the back can assist as well. But if it's a bigger particle, that might not dislodge it. And that's when you want to do this, which is called the Heimlich maneuver.
The Heimlich maneuver. But as Doctor also mentioned, very important, ensure that your area is safe. Like pull off from the road, you know, and don't just go and stand in the road with your hazards, because then some other things can happen.
Exactly. Always ensure your own safety first.
Correct. Very, very important. Thank you so much, Doctor. Shukran so much for that very important information that's been shared here this evening. We're talking first aid in the home, or even in your office, you know, in your cars. These things can happen. Call us 0216960109. Anything relating to our topic, inshallah. Doctor, something that might not be such a severe injury, but I'm thinking of blisters on your feet, especially with us ladies, you know. You know, we've got closets full of shoes and new shoes all the time. And sometimes, you know, you get these blisters at the back of your feet. I'm sure the males, the men as well, you know, but you people don't buy so many shoes like the wives. And so how do you handle that? Because it might not be, you know, a very dangerous thing, but it can irritate your feet. How do you handle blisters on your feet?
Okay, blisters on your feet, obviously from shoes, and you know, when you go eat shopping and you follow your wife all over the show, you can obviously get blisters as well, and the men can also get that.
Okay.
So what you want to do is not to pop it, because if you pop it, then the skin comes off. Right. That piece of skin that covers the blister actually is protecting the area underneath it.
Okay.
Because that area underneath doesn't have skin protecting it.
Yes.
And that means you're exposing the raw flesh to the elements. If the wound is very, very tense, it will pop on its own, and the fluid will leak out. That will give a bit of relief. You want to cover that with some antibiotic cream and gauze, and that you can just keep covered. If it's not settling, as in it's getting red, inflamed, or the fluid keeps on reaccumulating, then please go and seek medical attention and go and see your GP. And they should be able to then give you further advice on that. But importantly, you don't want to remove that skin off it, because you'll expose that area underneath, and that can lead to infection or further friction.
Thank you very much, Doctor. And of course, our topic, first aid in the home, with Dr. Riaz Ismail and myself, Najwa Mohammed Luddy. Doctor, fractured kids, you know, having your kids around, or your children's, your neighbor's children, or your family's kids, or even adults, you know, sometimes we want to assist doing some DIY in the home. What happens if you injure or you break? I need to stop. There's a call online. Sure. Can we take that caller quickly? Yes. Let us go to the lines. Assalamu alaikum and good evening.
Assalamu alaikum.
Hello.
Walaikum salam.
Can you hear me?
Yes, please go ahead with your question.
Thank you for an interesting program.
Pleasure.
But I'd just like to ask the doctor regarding roadside assistance for somebody's first aid. Is it advisable, because if something happens to the patient, you're liable to be answerable for that?
You know, there's something called the Good Samaritan Act, and certainly as a healthcare professional, if you are identified driving past the scene of a motor vehicle accident, or an accident where you could have rendered some form of assistance, you are then held liable. In terms of a person, an ordinary person, stopping at the side of the road and delivering assistance or providing assistance, just by stopping, parking your car in a manner that you will be blocking any other cars from coming closer to the accident scene with your hazards on and your lights on, you already are rendering assistance. Just by securing the area, preventing other people from getting too close, or from turning somebody if you suspect a neck injury, that already is delivering assistance already. But just put yourself on the opposite side of it. If it is something as simple as just clearing an obstructed airway and the person can then breathe and then continue to live, would you not want to do that? As opposed to worrying about the fact that you've turned them and maybe something else has gone wrong. So I would work from the principle that you're wanting to do good, that you want to try and assist the person, and that bearing in mind that if you know a little bit of what you're doing, anything that you do can only be good. And if you deliberately go and do something bad, obviously that's a different situation. But in terms of the Good Samaritan Act and just rendering assistance at the side of the road, you should do what you can. And as I said, even if it's as simple as disconnecting the battery, switching off the car that the accident happened in, if there is petrol leaking from the tank, ensuring nobody comes near it with cigarettes, or keeping a safe perimeter for other people not to get injured, that in itself is delivering first aid at the scene. I hope that's answered your question.
Jazakallah, it gives you a new insight to what I was thinking, and carry on with a good program.
Alhamdulillah. Shukran so much, my dear. Thank you very much for that inspiring call. 0216960109. The viewers are most welcome still to call us. I think we need to go for another ad break, Doctor. Sure. Inshallah, our program thus far has been very, very inspiring, with first aid in the home with Dr. Riaz Ismail. Quick ad break, and then we'll be back right after this, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. This is our last segment before we need to conclude our program with Dr. Riaz Ismail, and we're discussing first aid in the home, or even in your office, in your cars, as we were discussing earlier about things that can happen in your car and how we can assist even our children, or even somebody, as Doctor mentioned before we took our last caller, about giving assistance on the road. You might not be in a position to save a life, you know, in terms of assisting, but there's other ways and means how you can definitely assist when you see somebody struggling maybe on the road. Even as we know our situation in South Africa, maybe just even safeguarding that person's personal belongings.
Exactly.
The lines are still open 0216960109, anything relating to our first aid topic, inshallah. Doctor, talking about fractures, we know the kids fall out of the tree houses, and husbands fall from the roofs, and ladies fall from the stairs. In terms of fracturing your arms or your limbs or your leg, how do we handle cases like that? You won't believe it, there's a caller. Can you just hold on to that question? Let us go to the lines. Assalamu alaikum and welcome to the program. Hello.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam, my dear.
Walaikum
Please
salam.
go ahead with your question.
I just wanted to ask the doctor, what do I do when the child burns himself with hot oil, like fish oil?
Okay, we covered that a bit earlier. What we need to do is remove as much of the substance, because oil, obviously, because of the temperature, will continue to burn the skin. So we need to remove as much of that as possible. And firstly, take the child away from the area that it burnt, because you're never sure what's fallen on the floor. You might slip, you might also get burnt by it. And then with either a towel or dab onto it to try and remove that oil, and then the cold water. Most importantly, you want to reduce the temperature as quickly as possible. So the oil, if oil will spatter and burn if it gets continual heat and you add water to it. But if you take the oil out onto the skin and you add the water to it, it shouldn't spatter and burn. It shouldn't spatter and create that sizzling noise anymore, because there's no additional heat being added to it. So you want to wipe that off, dab it, not really wipe, because that might remove the skin, and then the cold water on top of that. And reduce the temperature of the oil as fast, and that area that's being burnt as fast as possible.
Right. Is the viewer still on the line?
Yes, I
Okay.
am.
All right. And doctor, after that, must the mother then rush the child to the emergency?
It would be preferable. Yes.
Okay. All right. Anything else, my dear?
And what happens if there becomes a blister on the hand, like blisters?
Okay, the important areas that we worry about usually in children, in anyone for that matter, but children in particular, are areas where there are multiple places where you can bend. So the hands, the face, the feet. Because if you get a contracture, which is a piece of burnt skin which is not dealt with properly, then you actually lose function in your hand or in that area, and you can get bad scarring on the face. So in those areas, what we would recommend is taking the child to an emergency unit to get attention. They can tell you that it's not serious and deal with it, as opposed to you taking the child in too late and they say it was serious and now there's a contracture burn. So don't pop the blister. Make sure that you have applied cold water, cold compress, or even ice once again into a towel over the area, and take the child with that to the emergency unit.
Shukran so much, doctor.
Okay,
Afwan,
my
only a
dear.
pleasure.
Shukran so much. Thank you very much for the call. Thank you to that lady for that call. 0216960109. Our lines are still open. Anything relating to first aid in the home with Dr. Riaz Ismail. Doctor, fractures. How do we handle broken legs and arms?
With fractures, the important thing is to splint the area that has been fractured.
Right.
So there are various ways to do that. Arms and legs are usually the areas that will require that, and you can see on the slide.
Okay.
The pain is due to the deformity. So when the one piece of the bone is moved from the other piece, and that can be in two ways, either closed or open.
Yeah.
Now, if it's closed, you will just see a deformity in the skin, and
Yeah.
you can see that's an obvious fracture. If it's open, you see a piece of bone sticking through the skin. Now, the one that you need, well, both of those you need to obviously seek medical attention, but the one where there is the bone sticking through, that's the one you need to worry about, because you don't want to get that dirty, you don't want to get the bone infected, because that can lead to long-term complications. And you can see that you can splint with wood, or even rolled up newspaper, and I've brought along the week in August. You can see.
Doctor, maybe you must just hold on to that. There's another caller holding. Can we quickly go to the caller? Assalamu alaikum and welcome to the program. Hello, my dear. Can you hear me? That call is very, very soft.
Hello?
Hello,
Okay,
we can hear
yes,
you.
please go ahead,
Hello?
my dear. Hello, caller.
Hello, can you
Yes, go ahead. We can hear you.
I can't hear you.
We can hear you. Please go ahead with your question.
Okay. Assalamu alaikum.
Wa alaikum salam.
Can I speak to the doctor?
Go ahead.
Can I speak to the doctor, please?
He's listening to you, my dear. Please go ahead.
Doctor?
Yes, I'm listening.
Doctor, if a foreign object... Hello? Doctor, if a foreign object gets into your eye, or a splinter gets into your eye in the evening, how are we... Hello? Hello?
I'm listening.
Go ahead, my dear.
Or a splinter gets into your eye, how are you going to attend to it at night?
Okay.
Okay.
You're gonna listen on the television, my dear.
Sorry?
You can listen to the answer on the
I can listen
television.
on the television.
Yeah.
Okay.
Thank you very much for the call. Hey, doctor.
Okay, so the important thing about a splint in the eye is depending on what caused it. Okay, so if it's not obscuring vision, it can wait for a little bit. But if it's obscuring vision or the vision is affected, then there is a problem, and then we will have to have it attended to sooner rather than later. So my advice to the person is that irrespective of, and certain things you don't want to mess around with.
Of course.
As I've said, burns in the hands and the face, but your eyes and splinters, you don't want to mess with that.
Yes.
So you need to seek medical attention, and for that you'd have to go to an emergency unit which is open after hours. And I would not sit and wait to find out whether or not my GP can attend to it in the morning. I would rather go to an emergency unit and have it attended to. And once again, rather be told this was not urgent.
Yes.
It could have waited. Then make that assumption yourself, and the next morning find that your vision actually is impaired by it.
Correct. Yeah. So very important. That will be an emergency.
That would be an emergency for me. It's particularly the eyes. You can't easily fix them.
Okay. All right. Thank you very much for that viewer, for that question. Very, very important question. Unfortunately, we won't be able to take any more callers because we have about 2.5 minutes left before we conclude our program. And doctor needs to still show us and demonstrate to us, in terms of a broken leg or a broken arm.
Okay, it's just interesting that when you did that, what you do is you're putting your arms in this way.
Yes.
So the way you can easily splint a child's arm is by just putting the one in the other.
Okay.
So if you just put the one over the other and take a bandage and wrap it around, you've splinted it.
Okay.
So that will prevent movement. So that splints it easily.
Yeah.
The same with legs. You just put the legs together and tie them together.
Okay.
But I brought along the week in August.
Yes.
And you can see that this actually provides
very
quite
solid.
quite a sturdy splint that you can easily use, and then you can just bandage it around. But I think what we need to just maybe do in our last couple of minutes
We've got 1 minute left, doctor.
last minute is just to maybe go to the back to our first aid kit, and then just to look at the first aid kit again, and just to for the viewers just to take note of the things that we've got on the first aid kit. And you'll see that the various parts that we've used already, we've used bandages of various sorts for stopping bleeding, and for blisters we've put some the antibiotic cream on. The disinfectants, we've used the burn shield, we've used the sharp scissors with the rounded tips to cut clothing off, and the tweezers we'd use for removing splinters, but that would be from a limb. I wouldn't let anyone else remove it from the eye. That you need a trained professional to do. And then obviously gloves. Many gloves would be important, so that you can actually prevent yourself from getting infection or transmitting infection to anyone else.
Dr. Riaz Ismail, shukran so much. We need to wrap up our program this evening. Shukran so much to all our callers. Really, really interesting program, mashallah. Of course, next week we'll be back, inshallah. And next week we'll be taking a look at emergency care, and once again there will be another IMA member in studio. I'm not sure if it's Dr. Riaz Ismail that will be joining us. Another member will be joining us next week, inshallah. Shukran so much. Well, I want to wish all of you, from myself, Najwa Mohammed Luddy, and Dr. Riaz Ismail, a pleasant week ahead, inshallah. Fi amanillah. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh.